Good morning, everyone. We are live. Okay. Today I'm going to discuss a case and some finer differentiation between the remedies. Okay. So we'll wait for 2 minutes till people join so they can understand the case, and then we put that case and the whole video on YouTube also, so that you all can go back and learn from it. Okay. Okay, so I have shared this case yesterday with a group which is called as Conium Maculatum. I am going to discuss this case again for the people who's not a part of that forum, and I am going to share some more cases which would help you to differentiate these closely coming rubrics or the closely coming say of the patient. You know what the patient says and how we convert it into rubrics. What we do is we understand how the disease is impacting the person. What is the change or what is bothering him the most, because of the disease. For example, I'm going to share 3 cases of recurrent cold and cough or bronchitis or asthma. The disease doesn't matter. A lot of people said that please show the cases of, asthma. So the disease doesn't matter. What matters is the patient's reaction towards the disease. Okay, so I'm going to tell you the first case. This was a case of a 14-year-old boy. He came with his mother, and the mother started talking about it, that he has this recurrent cold and cough. And I said that he's a big boy, he can talk on himself. On this he smiled, and the mother was like, okay, you go ahead and talk about it. And then the patient was talking very, very in a low tone. It was barely audible. And, he was like, I have cold and cough and a little headache. I asked from when you have it. He said, maybe from childhood. I said, do you always talk so low in tone? And the mother said, no, just like that. Talk fast, talk a little louder. The doctor is not able to hear you. And then he kept on talking. I have to really concentrate to listen what the patient is trying to say. So then he said that I have cold, and I said, how is it bothering you? He said, I'm not able to study in school when the AC is on. I have to go to the sick bay and I don't feel like studying or doing anything. So mother said, he kind of become lazy to it. He doesn't want to do anything. And one more thing is that the patient said that, I don't feel like doing anything. I feel lazy. I don't feel like studying. And because of the cold, I am not able to study also. Okay, so then he was doing these kind of movements, like this. So I asked, are you shy? He said, no. Then I asked mother, is he shy? He said, no, he's the conscious type. In front of people, he become little conscious. He's not shy. Talk now. No. Okay. So I said, are you scared in talking in public? He said, no, slightly, I said, okay, because why I was asking these questions is because he was feeling very uneasy in front of me, 14-year-old boy, normally they are very confident, and so he was very uneasy, getting conscious about. Then what happened was, if you have any queries, you please ask it in the video so that I can answer them. Then what happened was that I asked him that how is this cold bothering you? He said that I am not wanting to study or do anything when I have this cold. And something else, he said nothing. So there are patients who really don't talk much, and then we get very little information from the patient itself. Then what we do is ask the mother, okay, how is he by nature? He said he's very good boy, very nice, always helping, very obedient. He listens to me, whatever I'm saying, and very nice, he's a good boy. He doesn't bother me a lot. So I asked, then she said that my younger one is exactly opposite of it. I said, how is he? So he is very, very chunt kind. So I asked him, how are you with the younger brothers? if you are not able to find a stress directly and the patient's reaction to the stress, you understand the dynamics in the house, and then you understand that you can probe in those areas. I said, how are you with the younger boy? He said he teases me a lot, and he keeps on going, like if he wants to tease me, and if I tell him that stop, he doesn't stop, and then I hit him, and then he starts crying and howling, and then he goes to my father, and my father feels that I am bullying him, and then I end up with scolding. So I said, he doesn't listen. Then the mother interrupted and said that the younger one is really manipulative. He is not at fault. The younger brother is, younger son of mine is really manipulative. I said, okay. And this case took me, normally, it takes 7, 8, 10 minutes. This case took me good 18, 20 minutes to understand this child, to understand how this cold and cough, which this boy has since childhood till 14 years of age, is bothering him so much. And the mother said when he was small, he used to exercise and play and run around, and with that heat in the body, the cold used to subside. But now, as he has grown up, the studies have increased, and there is more of time where he has to sit and study, so it really doesn't go, and it has started bothering him. So we have taken a lot of allopathic medicines, and then we thought that let's go for homeopathy. So this is the case. And any comments? What are drugs that you are thinking of? What remedies are coming to your mind? What is the main focus of the child? In every case, what is most important is how is the disease bothering the person? How is the disease affecting the child or an adult? So in this case, what was affecting the child the most was he doesn't feel like doing anything, So I took it work aversion to mental coryza during. Okay, I'm just going to take out yes. So the rubrics that I took were, in this case, we can see that he is little timid and shy, but more than timidity, what is very marked in this case is he was feeling awkward in the sense he was feeling uneasy, that I'm saying that he's touching his face, he's looking here and there. So I took awkwardness, bashfulness from. The mother said that he's mild, mildness. Basically, he's shant by nature, so quiet disposition. Work aversion to mental coryza during. This is the very important rubric. When we take an understanding, what is most important is that we should evaluate. What is the rubric? What is that thing in that case that you don't want to miss? You can probably miss timidity, but what is the case that you really don't want to miss was work aversion to mental coryza during. Uske man nahi karta hai ki wo kaam kare. We can also take business aversion too, because the work is the business for him, and business incapacity for he is not able to do studies, and rest of the rubrics that I told you. And the medicine that I prescribed was Calcarea Carb 30. This patient came to me in 2017. I had given Calcarea Carb 30 3 doses, and he came for one follow-up, and after that, after 2-3 years, he came last week. And then I asked, "Kahan gayab ho gaye the? How are you?" So he said that I was fine. So his mother also called me and said that he was absolutely fine for 2 years, no complaints, nothing, no cold, no cough, no headache, nothing. But since 2 days, because of the rains in Pune, it has started again. So I said, okay. So if the remedy is right, and if you can understand the core of the patient, you really don't have to repeat a lot. Only 3 doses of Calcarea Carb were enough to cure him, and he was absolutely symptomless for 2 years. He was able to eat, drink, go around, everything. In the same lines, I am going to tell you 2 more cases, right? So, if the very common problem of bronchitis, cold, cough, these problems are lingering, These are not that you have an acute for 2-3 days and it's gone. These are the problems that goes on, for months, or every change of weather you have that. So what I usually do is I ask, how is it bothering you? How is it affecting your daily routine, or why are you so concerned about it? So one more patient, I will say, he said, when I have cold and sneezing and I'm studying, in the classroom or when I'm going for tuitions, I'm suddenly sneezing and my link breaks. Suppose I'm drawing something in home, and he used to love art. So suppose I'm drawing something in home and suddenly I start sneezing. So my thought link completely breaks and I'm not able to recollect, immediately, oh, where were I? So I don't like that. For in that child also, he was around 14-15 years of age. I kept on asking that, what is bothering you? Why this cold is bothering you? Why are you concerned about this cold? So he told me this was the main. Rest of the case was also there, but I am just trying to explain you the most important thing in the case. So in that case, what was the rubric? I took interruption aggravates. What is interruption? Something is going on and there's too much of trouble from people above. Anyways, so something is going and something interrupts. When we used to see Doordarshan TV, there used to come "Rukavat ke liye khed hai." So interrupted, that line, that sequence is interrupted in between. So when he has cold or when he's sneezing a lot, the chain of thought gets interrupted, and then that was his botheration. So there I took interruption aggravates, and with rest of the rubrics I gave Staphysagria 30. And that case also, with one dose of Staphysagria 30, he never came back with any complaints. One more version, what it can be, with one more case, he said, I asked why this cold and cough is bothering you so much, and he said, I am not able to work, I am not able to study, I am, everything is getting affected because of it. It is what he says and how he says. And that saying should be very, very important to the patient. It is present, it is persistent, and it is predominant, that we have learned in the Segel method. So how it is bothering you? He said, it is the work, my class, my everything is getting affected. Because of this cold, one child told me that I wanted to go into army. And for that training, we have to run early in the morning for those exercise practices, and with this cold and cough, I'm not able to get up, and if I'm getting up, while running, I'm continuously sneezing. So it is affecting my my ambition or my work. I'm not able to reach my goal, I'm not able to do what I really want to do. So any inputs in such case, what will you take? I took delusion hindered work at his, and there is only one remedy, which is China. So same complaint, but patient's reaction to that complaints vary, and from that reaction there are different drugs, there are different core of different remedies, and then you prescribe. And that China 30 is used in cold or not, that is immaterial. What is important is what the patient is, how this cold is affecting the patient, and how it is bothering him. So delusion hindered work at his, and I had given China 30. So the diagnosis is important just to understand the prognosis of the disease. What is more important is how patient is getting affected by that disease. For example, nux vomica. How would nux vomica feel? Nux vomica ko, he's industrious, he has mania for work, he's business oriented, and he feels when he has this, he feels he doesn't want to get disturbed, he disturbed averse to be. There's a rubric irritability coryza. In coryza can be taken as a physical coryza, or it can be taken as trifle. Coryza is very trifling thing, so he becomes very irritable, he doesn't want to be talked, he doesn't want to be disturbed. So disturbed averse to be, quiet wants to be, repose and tranquility desires. Quiet is, when you study a rubric, you see one thing. So quiet is chup, wants to be, I want to be quiet, and repose is rest, and tranquility is peace. So he wants rest and peace and nobody to disturb him, right? I can see a lot of people joining, but I cannot see a lot of comments happening. So I would request you all keep your understanding of the cases also that I am discussing, and the remedy that comes to your mind. Okay, I know I am not discussing a lot of particular rubrics that he's better in the morning or aggravated in the morning, but that is not the way I prescribe. But here I would like to give you a tip that Qualified mentals are very, very important. What is qualified mental? Qualified mental is a mental symptom with a physical modality. For example, anger, redness of the face with, or quite the way I told in this case, work aversion to mental coryza during. So these singular rubrics, yeah, laziness coryza during, or indolence coryza during, all of this is single of Calcarea carb. So start studying. See, a lot of people ask me which book you are studying. Please suggest a pediatric book. There is no any particular book that I am studying. Or this is a lot of study of the repertory, and try to see the repertory in the angle the patient says, or try to convert the language of the repertory in the normal language of the patient. So you are able to understand, and these rubrics are not given in a particular book. This is my observation, and my observation say you have to convert this observation into rubric. So if you're seeing the focus of the patient is that he's getting affected in his work, he's getting hindered at his work, then you can give China. Or if you're seeing that, something that, I'll give you one more example with the similar lines. Why I'm sharing all these cases? Because they have a similar thread. There was one patient, he said, he also had cold and cough and bronchitis, and he said, I love trekking and I love climbing and adventure and all this, but because of this cold and recurrent sneezing and coughing, I'm not able to do. So in this case, what was happening is, the things he is not able to do. The thing which he things that he is very fond of, trekking, mountaineering, hiking, he's not able to do, and he was really sad about it. So it is a very interesting rubric, which is sadness, continence from. Continence is where you're not able to do which gives you pleasure, So as caution, so you do continence, you do abstinence. So in the same way, the patient is sad because he's not able to do something which gives him pleasure. So it is sadness, continence from. Drug like, I think, Conium, Belladonna, there are 4 drugs in that. My laptop has, the charging is not gone, so I'm not able to exactly see. But in this way you have to understand how the person is getting affected by the disease and what is the main feeling of the patient. And in that case, I think I've given Conium. He was much, much better because that was the main focus. Obviously, I'm not saying you prescribe on singular rubrics. Yes, you can. If you're so sure of that rubric, that this rubric defines the personality, or otherwise there are some supporting rubrics which you take, or some supporting symptoms that you take to understand the patient in totality. Okay, recently I'll share I had a patient who was 50-60 years old, and he had a complaint of uric acid and gout, and he has severe acidity since so many years. And I said that he had taken allopathy, but he has not taken any treatment which is very consistent and, very with lot of hard work. I said, why you are not taking? He said, I like to eat vada pav and, street food. And with any treatment, people ask me, the doctors ask me not to take all this. And I said, I cannot do all this. And I want to eat my food, So he was very sad and affected by restriction. And so I took frivolous because he was not very serious about the disease in spite of suffering from so long, and various other rubrics. But what he wants was freedom. What he wants to be free. He should be able to eat everything, do everything. That was his feeling, and the libertinism, freedom. There are in rubrics. There are so many rubrics that they are so close. You will feel that this is delusion hindered work at, or this is interruption. But there is a very, very fine differentiation in all these rubrics. The way I described hopeful, optimism, pessimism, and positiveness. In the same way, interruption aggravates, disturbed averse to be, and intolerance to interruption. In the same way, we have interruption intolerance of, interruption aggravates, and interruption aversion to. So, Yeah, government. Yes, government is a very good rubric, but government is a where we take it government where the patient has a liking for food. He's a khawaiya. He's fond of food. I was also thinking about this rubric in that case, but what was in that case is it is not that liking that he was talking more about. It is about that he doesn't want a life which is restricted, where you don't eat this, you do this, you do. I want to live free, and that freedom is a core of Belladonna. So when the patient talks, they are very very close. Symptoms coming, but you have to do that finer differentiation. जैसे I talked of interruption aggravates, means interruption की वजह से I am going to aggravate and I would, it will affect me. Intolerance is something which I would not tolerate at all. I just don't tolerate anybody interrupting me when I am doing my sessions, or interruption. Aversion to. Aversion is a dislike or a like. When we say sweet aversion to or sweet desire for, it is a basic liking and disliking. In the same way, we have very very close rubrics where we all need to differentiate and find the finer understanding, and this is not given in any book. There is no book, no amount of this. You have to open your dictionary and understand the finer differentiation. And when you understand the finer differentiation, you will be able to come to the right remedy. The repertoire is so vast that it is not possible that I know all the rubrics and I know all the differentiation. So what I have learned in all these 16, 17 years of practice is you understand the main feeling of the patient. Don't get into hurry of rubrics. Earlier, what mistake I was doing is the moment patient is smiling, I used to take smiling. He's shy, I used to take shy. He's looking here, I used to take evading the look. I'm not saying this is not important, but what is most important is you understand what is bothering him most. There are cases where patient talk for 40 minutes or 30 minutes and the patient is crying and saying my mother-in-law troubles, or my husband beat me up, or the boss is bothering me. No doubt you can take ailments from domination or disputes in the family, but what patient is talking about, what is hurting the patient most is, the patient will say, yaar, ghar mein koi respect hi nahi hai, there is no respect in the family. Or the patient may say, yaar, itna karte hain, I'm working since morning, I get up at 5 o'clock in the morning and I'm working till night. There's no appreciation. It feels like I am just, doing what is. Or the patient doesn't want anything and the patient feels that this is my duty and this is, I am bound to do this. How can I say no to this? So is the patient longing for appreciation, or is the patient feeling that delusion appreciated she is not? Or the patient is dancing in the sense, dancing in the tunes of life, and he's feeling better by dancing. So the remedies like sepia, carcinosin would, do a lot. Carcinosin would do because he feels it is my responsibility, towards the family. Next time I'm going to talk about carcinosin children and a carcinosin adult. It is a very, very beautiful remedy, very oftenly used in our practice. Sometimes we miss in pediatric cases. So next time I'll talk about carcinosin. I'm telling the remedy because you all can go read about carcinosin, pick up as many queries as you want, and you can ask me. If I know, I will be happy to answer. If I don't know, we all will work together to, find the right understanding. So, yeah. So, I was talking about a dispute in the family. Yeah. So, what is bothering him? Respect nahi hai, to respect kiska core hai? Respect is basically the core of Hammermillis. He feels the opinion should be respected. There is no respect in the family. Respected he is not. So in that way, those smaller observations are very, very important, but the core is also very, very important. Why all this disturbance in the family is bothering him? How he is affected by that disturbance, and what is his reaction, what is his expectation, this is basically any questions that if you have, or I'll just stop with these 3-4 cases. I especially didn't took any remedy this time because I wanted to take, because what was I getting the queries the most was how you study, is there any book that we can study. This is not written in any book. You have to study a lot of same medicine from many books, and the best way to study is that you study the rubrics of that remedy. First understand the singular rubrics of that remedy and then try to understand the other rubrics, so you understand the code. This is only present in that medicine, it is not present in any other medicine. And there are some medicines which are very, very close, like carcinosin, CPR, natural mure, but the core is different. The core can be of dignity, which is of natural, or carcinosin basically has ailments from domination a lot, and then he starts feeling it is my responsibility to take up everything, and then, or whether it is love and care of cocculus, nursing of cocculus. So I think 90% of the cases you can get solved. Sometimes the case is very, very short of 4-5 minutes, and you take a totality by the rubrics, by the understanding of the patient. And sometimes the case is of 30 minutes because the patient is in that state of crying and venting up. And the patient may say that मैं किसी से बात कर लेती हूँ तो अच्छा लगता है, या मैं सब मन का निकाल देती हूँ तो अच्छा लगता है, या पेशेंट कोई मेरे पास आके उस समय मेरे को बोले कि it's okay, you'll be fine. So she likes consolation, or she wants to be consoled, or it is consolation ameliorates. Every word has at least 5 rubrics. If you don't contradiction intolerant of, contradiction aggravates, anger contradiction from, irritability contradiction from. So if you don't differentiate between these 4-5 rubrics, probably आज anger ले लिया, कल मन किया तो irritability ले लिया. It is not like that. If these contradiction को लेके 6 rubric बने हैं, तो there is some understanding behind that differentiation. Right? And try to study the cross references also. For example, I'm studying appreciated, it is not. So probably I would understand longing appreciation for, or delusion scorned being is she's looked down upon. So, and then find that finer differentiation in those words. And then, or the patient is not talking about what mujhe chahiye, the patient is only talking about the torment that he's going through. So delusion tormented he is. So how the patient is talking and what the patient is talking is very, very important. And the only way to understand is, yes, I gave single medicine in all the situation. And to be very, very honest, my father is a homeopath, my chacha is a homeopath. So I belong to a homeopathic family. But everybody practices, polypharmacy or specifics. But I realize the kind of result that we have from a single medicine is amazing. You don't need to repeat it. I have treated cases of asthma, recurrent bronchitis with single medicine, with single dose. I'm not saying there is any harm in repeating, but the more you understand the code, the less the repetition will be required. I have been using cases of asthma, LM potency, because I don't want to give nebulization, or I don't want to give inhalers or steroids. So I tend to give LM potency where I can repeat the dosage, and I have good results with that. Yeah, so how is our repertory constructed is that we have symptoms of present tense, past tense, future, and we have dispositions. Paru Shukla, I'm answering your question. It is that what is most important is during stress, is during, that state of disease. But if you don't get that, and you can support your totality with understanding of the patient. For example, in this case, the first case I took quiet disposition, I took yielding disposition, I took mildness. This is a basic personality of the patient, To support my totality, we can take that. I take that. I know there are different views about it, but I take that. So yes, but when we form a totality, what we should do is evaluate the totality. Evaluate in the sense we should see what is most important. What is most important that like in this case in repertory, yielding disposition children in that Calcarea Carb was not there, but I can miss that, but I cannot miss work aversion to mental coryza during, or I cannot miss indolence coryza during, because that was the patient, you know. So evaluation is very, very important. Yes, you can take dispositions also to answer that. Okay, dullness, fever, how different otherwise restless child normally. Yeah, so fever is a very interesting topic, because you have to probably we can talk about fever in one session. I have studied fever extensively. I have made notes on from Whitaker to understand how the patient's physicals react, or understand the third, and I have understand the mind also. So there's a small tip. What you can do is in search window you can put fever, and or you can put heat, and understand all the mental rubrics that comes with fever and heat. And Nutan, you can probably study those rubrics. Like for example, you don't have dullness fever during, you have dullness heat during. So the patient becomes dull, or the restlessness heat during. So sometimes you can take fever, or sometimes if the fever is not available, you can take heat, and or irritability heat during. 2 weeks back, my daughter had fever, and I would next time probably next time, because next time we are doing carcinosin. Where you can search rubric work aversion to mental. Yeah, this is the rubric work aversion. It is in the mind repertory, you know, the mind section of the repertory. Yeah, so there is a search window called as F4. So you press FN F4, and there is a tabular form that comes, and then probably you can put the rubric that you want, and or the word that you're looking for. Or you can press shift and question mark that you have in your laptop, and then you can put the rubric in the sense the word that you feel is the core of the patient. For example, I feel the person is feeling neglected, so I put press shift and question mark and put neglected in it, and all the rubrics covering neglected or the cross reference would come. Okay, Dr. Soumya, thanks. Can be used 200, 1M, etc. Superficial remedies, Rustock. These are not superficial remedies. Rustock, Struckbrinia, Nux vomica are very, very deep acting remedies. So any Belladonna is not superficial, Aconite is not superficial. So let us all come out of this fact that any remedy is superficial acting. These are not superficial acting remedies. I have cured grave cases by Brinia. Brinia has a different totality, so you have to understand the mind of Brinia to prescribe Brinia in chronic cases. I had a case recently of Brinia where the Brinia ko money की बहुत चिंता होती है, business की बहुत चिंता होती है. He feels I am poor, and so if you get that kind of a core in a patient with disease like anything, like maybe even cancer, then probably you can prescribe. We can prescribe Brinia, and we can treat cancer with Brinia. I don't repeat it that often. If you feel that the symptoms are coming back and you need a repetition, then you repeat it. If the medicine is not able to cure, potency is a different topic altogether, when we should give 30. So probably we'll take one session only on potency and repetition. We have to understand the susceptibility and sensitivity of the patient to understand the remedy. I'll give you a small tip. The more mentals are affected and you're prescribing only on the mental totality, I prescribe only on the mental, but how sensitive are those? You can go a little higher. But the more physical you are prescribing, this is I'm giving general. I don't usually take physicals a lot. Probably you can go to this is a general rule. If you're giving an organ remedy which you're basing the prescription on all the physicals, you have to go lower. Don't give organ remedies in a higher potency. Go lower. And the more psychiatric patients where there is a lot of role of mind and the kind of totality you have formed, you can go a little higher. Safe it is to start with 30. That is what I do. All acute and chronic remedies are deep acting remedies. Mostly remedies that Brinia, Calcarea, Natrum, Kali, everything is deep acting, unless that we are giving a very even elos is deep acting. Elos has a mind, so we have to understand the mind of the elo to give it as a deep acting. We are always giving it in diarrhea. No, elos. I had a beautiful case of elos. It is not very oftenly I have given, but I have given in 2 of the cases. But one of the case, the video has gone and I don't distinctly remember the case, but I remember that the core of the elos is brotherhood sensation, unification sensation, yeah, so you have to understand LM potency. Yes, I'll discuss it. So it's a different topic altogether, but we'll discuss that. Anything else that you want to ask? I think I have to rush to the clinic also. On Thursdays I'm keeping it a little late. I would request you all to please join us live only, because then we can have this kind of interaction that you are asking, and then we can tell about the remedies. It will be a more pleasurable session. Yeah. So anything else? Thank you for joining. It's been a great pleasure, and it is this opportunity that I have started has given me also, to go back and study. And there are so many things that I am learning, and I have missed in all these years, because we don't really go back to our cured cases. We only go back to the cases which were not responding. So when we have to present, we go back to the cured cases, and there is something new that we learn. Okay. So if all are okay with the afternoon session, probably I will start taking it in the afternoon. It is easier for me also. Probably I can come back from the OPT, and so suggest a time that you all feel is more comfortable for you all. I'm absolutely ready to take it in the afternoon. Okay, Mobin. So taken. So probably from next to next Thursday, we'll try to. If you all feel afternoon is a good time, so probably afternoon is good for me also. So yeah. So thank you everyone. It's been a pleasure, and hope we all learning. I am planning to take a small paid session with a very, very less amount, where I can show pediatric cases or the cases of an adult, the videos, and those who probably it would be a 2-hour session, the minimum amount of 200 rupees. And why I'm taking an amount is because there is a lot of sincerity which you pay. It is sad, but it is true. Even if you pay a 50 rupees, I always feel people who come poor to my clinic and who are not affordable to pay the fees, I always charge them even 100 or 200 rupees, because that people attach a lot of value to the money, and when you pay, you have a little sincerity towards it. So those who are interested can message me or WhatsApp me, or then probably we'll plan a session on one Sunday, if Sunday is comfortable, or whatever day you suggested, for 2-hour session, and then we can take those video cases, so you have a more deeper understanding of those remedies. Okay, so who all are interested in that session, it's a minimum amount of 200 rupees, 2-hour session. You can drop a message, and probably we'll plan that. Okay, thank you, have a great day. Okay, done. I'm fixing it for afternoon. From next to next Thursday, we'll take it in the afternoon. 3 o'clock is fine for you all, so we'll freeze it for 3. Okay, so next to next Thursday, 3 o'clock. Okay, thank you.